I just wanted to share a recent fun transformational story that's very close to home and is my own brother, my own older brother, Jonathan. He is the responsible party for, at one point, getting myself and both my parents to eat a paleo-like diet. This was back in 2012. And since then, since I've come to adopt a whole food plant-based lifestyle, I've managed to convert both my parents and most recently my brother. And so I wanted to share his story. The PowerPoint I'm going to show you is actually one that he created himself. And he recently shared with his entire company. He's CEO of a biotech company called Ignita, based in San Diego. They have over, I think, 140 employees. And at their monthly meeting, he shared his story with the entire group. So let's see if I can pull it up.
There you go. Okay, great.
Can you hear me, Gustavo?
Yes, we can.
Okay. So this is not my presentation, it's my brother's, but I'll be presenting on his behalf. And the reason I wanted to share this also is because I did get a question just about the ketogenic diet. And so I thought I could somewhat answer it in the course of this presentation. So my recent wellness journey, and he presented this on September 1st, so just this past month. In college, Jonathan weighed in the 170s, but this reached a high water mark at the end of 2010. As you can see, he's in the 1990s, he was 175. That was when he was in college. And then 2010, he weighed as much as 188. And just so you know, he's about 5'9.5". Okay, so this put him just in the slightly overweight category, not even obese. So he started a low carb ketogenic diet, and ketogenic diet is a diet that's very high in fat. 70-80% of your calories oftentimes will come from fat, and then very low carb, usually less than 50 grams per day, and low to moderate protein. But look at he did experience some pretty dramatic rapid weight loss. So he went from 188 all the way down to 158 pounds in over a few months. In terms of what he was eating, at the bottom of his pyramid was a lot of animal products, eggs, fish, red meat, chicken. He did have a lot of vegetables. So I do want to point out that one of the good things about a ketogenic diet is it does move from processed foods. It does emphasize generally whole foods, though oil is, I think, an exception. But it also does include a lot of leafy greens, and that's all good. Fruits are minimized to just berries. And then, as you can see here, oils, cheese, and carbs are very much minimized, the complete antithesis of a starch-based McDougall plan. Eventually, as is often the case on a ketogenic diet, it was difficult to maintain that. And so he slid a little, and his weight kind of bounced up to 165 and then 170s. But what was most concerning was what happened with his cholesterol. So his cholesterol got as high as 242 total cholesterol with an LDL of 180. And this was in June of 2013. Even after he kind of backed off it a bit, his cholesterol still remained high with a total cholesterol of 211 and an LDL level of 146. So the big problem in terms of a ketogenic diet is there's an emphasis on meat, which is full of saturated fat and other pro-inflammatory substances. This is a famous double animal style, protein style burger at In-N-Out that's not actually a menu item. You have to order it off the menu. Bacon, chicken, ribs. And then the other big problem is that it cuts out lots of the core parts of a whole food plant-based diet, right? So legumes, which have been shown to be a core part of the diet of civilizations all across the world that have thrived over the centuries. If we look at Dan Buettner's book, The Blue Zones, where he looked at around the world at populations living well past 100 and thriving, one of the key components was legumes, whole grains, fruits, certain types of vegetables, especially the starchy vegetables like winter squash. All of these are off limits on a ketogenic diet. So he relaxed his diet even further, and his weight started creeping up again till it reached again another high water mark of 179 in June of 2017. And his weight gain actually exacerbated his chronic low back and joint pain. And it's kind of sad, but it's also funny. It came to a head at Ignita's holiday party one year where he was just carrying his laptop. And all of a sudden his back gave out on him. And he actually had to use a cane. And my brother's just five years older than me. I'm 40 years old. He's 45. And he was completely incapacitated, even bedridden for a short period of time. And so we actually were talking on the phone back in June, and he was talking to me about his back pain. And I told him, I was like, Jonathan, there's no question in my mind that if you were carrying around a 20-pound bowling ball, 15 to 20-pound bowling ball less of weight, that your back pain would be significantly improved. And so he's like, well, yeah, well, how am I going to do that? Like, you saw what happened when I went on the ketogenic diet. I lost weight, but my cholesterol went sky high, and it was hard to maintain. I said, well, what I want you to do is for 3 weeks, just give me 3 weeks of doing a 100% whole food plant-based diet. And I got to get you over this misconception that starches and carbohydrates are the cause of your weight gain. What I do want you to get rid of are the processed, refined carbs. So, he needs to give up the Twizzlers that he was eating after dinner every night. He needed to give up the Marie Callender's strawberry pies that he would get on a regular basis. So he has to differentiate between healthy carbs versus unhealthy carbs. But I absolutely want him eating lots of whole grains and starches that are rich in complex carbohydrates. Well, he decided to follow my advice. He thought I could do anything for 3 weeks. And what he experienced was a very dramatic, rapid weight loss. One of the more dramatic, honestly, that I've seen in someone who is not significantly overweight. A weight of 179 with a height of 5'9", it's BMI probably I didn't calculate it, but it's probably about 26, 27. So he was just in that barely overweight category. And despite that, just from switching his food, and I told him to eat as much as he wanted. So what we call an ad libitum diet. I said, eat till you're satiated. You could see that over the course of 2 months, he basically lost over 20 pounds. And so he went on to explain to his company what is a whole food plant-based lifestyle, which I'm not going to get into. But he contrasted that, but this is what it is not. He had a Doritos challenge. This is the kitchen at his Ignita office. They had a Doritos challenge. So clearly this is not part of a whole food plant-based diet. And these are the new 4 food groups that is part of his daily lifestyle now: fruits, vegetables, whole grains, and legumes. And so now his breakfast looks like something that he had completely avoided for many years. It's oatmeal with bananas and blueberries and maybe a small amount of nuts. He eats a lot of salads, sort of a balanced meal of beans and rice and vegetables. It's funny, these pictures are actually pictures of what I've eaten, but he was too lazy to take his own, so he used mine. Weight loss seemed to be working, but what about his labs, right? That was the big question in his mind. So he had lost weight, but he had done this before on a ketogenic diet. He was curious about his cholesterol. And so if you remember, his total cholesterol was a high of 242 with an LDL level of 180. When he backed off a bit, it dropped a bit, but still very high with a total cholesterol of 211 and an LDL of 146. Well, he checked again recently. I had actually wanted him to wait because oftentimes your cholesterol can be a little bit high as you're losing a lot of weight. So I think it's actually going to end up even lower, but he couldn't wait. And so he checked and look at the drop. He dropped from 211 all the way down to 176 and his LDL from 146 down to 118. This is the lowest his cholesterol has been over the last 5-6 years, and a very notable drop from where he was eating at his high cholesterol mark when he was on the ketogenic diet, a significant drop from the high of 242. And this was a picture of him on June 1st, 2017, at a Warriors game. And this was before he had adopted the whole food plant-based diet. And that's him 3 months later, August 31st, 2017. And what's also notable is that in addition to weight loss and normalization of labs, his other key benefit has been a significant increase in activity. So he has no more joint pain or back pain. He's resumed his previous physical activities. And for the first time in a long time, he's able to do something he had kind of given up all prospect of doing again, which is a pull-up. I'm a huge fan of pull-ups because it's looking both at your strength, but relative to your body weight. So I've always found it a little not too impressive if someone can bench 400 pounds, but then can't lift their own body weight. So I like the pull-up for that reason. And I used to not be able to do a single pull-up in my life. This morning I did 9 pull-ups. If you're not working on pull-ups, then consider adding that to your exercise regimen. And then he ended his presentation with Hippocrates, let food be thy medicine and medicine be thy food. So I just, I can't tell you how exciting it has been for me to witness my brother, who was a very passionate paleo, ketogenic, and they are different. I'm not going to get into the differences between a paleo diet and ketogenic diet and low carb, but they're kind of, I put them all in that genre because they all emphasize low carbs. To go from that whole area to now a very passionate whole food plant-based advocate to the point that he's sharing it with his entire company. And I just talked with him this morning, actually. And he told me that he got more questions about that presentation than he had on any other, presentation he had given, which shows the level of interest that people have in healthy eating and nutrition and addressing the core root cause of their illness, whatever it may be, whether it's back pain, high cholesterol, gout, peripheral arterial disease, heart disease, to really getting to the root cause. Because what I could have told my brother when he called me back in June is, well, dude, why don't you do some physical therapy and take some ibuprofen or naproxen as needed, and do some stretching, right? But I knew that's kind of dancing around. that really, to get to the root cause, I needed to help him get to a healthier weight. You saw the pictures, what a notable difference in a few months. I had to help him get to a healthier weight, and eat a healthier diet and decrease the overall level of inflammation that was going on in his body. And so if we circle back to one of the patient's original questions on the concerns I have with a ketogenic diet, I already mentioned that I do think there are some benefits. I think the fact that they cut out processed food is huge. Same with paleo. The fact that the paleo and ketogenic diet cut out processed foods is a huge win because it puts the emphasis on whole foods. And the fact that there are many people eating a ketogenic diet that eat lots of green leafy vegetables, I think, is also great. But this emphasis on the basically limitless amounts of fat and oil, which I've already just talked about, is and in the paleo diet, limitless amounts of meat products, no matter how high quality the meat product it is. I think raises long-term health issues, even as serious as death. There are multiple studies showing that over the long term, there is an association of being on a low-carb diet and increased rates of mortality. So that's the most serious. And then in between that, we've got increased risk of kidney stones, increased risk of osteoporosis, increased risk of constipation and general gastrointestinal disturbances, nausea, vomiting, diarrhea. These are all, bad breath, halitosis. So from the mild to the severe, I think that when it comes to a ketogenic diet, people need to focus more than the physical manifestation of weight loss that's occurring and be concerned about what is actually going on underneath the hood, what is going on in their arteries, in their gut, inside the body that is potentially or very likely compromising their long-term health. And whenever in doubt, if we just get away from the studies, I always like to look at I get this from Dr. McDougall. Let's just look at populations around the world that are thriving, and if you haven't read Dan Buettner's The Blue Zones, then read it. The populations that he studied, whether it's Okinawans in Japan or Sardinia, Italy, or Loma Linda, California, none of them are eating a high-fat, low-carb diet. In fact, they are all eating a diet that is 90% or more fruits, vegetables, legumes, and grains. So why do we keep trying to find some new fad to hop onto? Why not just stick with what has worked for across the span of history, and keep things simple, and adopt a lifestyle that is very well supported by the scientific literature?